Honorable Bloom.
Thank you, Madam Speaker. Madam Speaker, in the old Parliament, this debate used to be known as the no confidence debate. But what is unique about the Honourable Premier's address is that he admitted his own no confidence in his own provincial government. I want to ask, how is it possible that this provincial government is unable to fix the Makhura Johannesburg Hospital? According to the Honourable Premier, the reason why the Department of Infrastructure Development was removed from this job is because of, quote, the failure to deliver on time and huge concerns and overpricing for the refurbishment and construction work. Now, the fire that destroyed this hospital, or part of it, happened 10 months ago. And if this was a private facility, you can be quite sure that it will be substantially repaired and operational by now. But 2 weeks ago, the CEO of this hospital desperately called in the gift of the givers to do an engineering assessment because of the damage, because it hadn't yet been done. Just think about this. An engineering assessment is the elementary first step in repairing any building, but DRD couldn't even do this. But let's be fair. We do know what DRD is very good at doing. It's very good at choosing fishy contractors who can't finish the job on time, but they still get paid, and other contractors have to be hired at extra expense. And this has been the case for all of the 8 years that the Honourable Premier has been in office. It's 8 years in which he hasn't fixed DRD, and he hasn't fixed the Gauteng Health Department either. And it's 8 years in which he's talked about fighting corruption and inefficiency, and yet it still continues. The SIU is now investigating 2 fishy contracts for 128 million rand concerning the hospital repair. 9 hospitals have now been suspended, 6 from DRD and 3 from health. The Honourable Premier says that he is filled with pride that Gauteng is commended for swift implementation of SIU recommendations. And then he says he will, quote, continue to focus on promoting a responsive, accountable, effective, and efficient public service, building ethical governance and eliminating corruption. But really, I have to say, instead of pride, the Honourable Premier should be expressing shame. He should be ashamed that Gauteng has the most SIU investigations in the country. He should be ashamed that he didn't prevent this corruption in the first place. And this corruption includes hundreds of millions in PPE corruption. It includes spending 750 million rand, including not just the building costs, but the medical equipment and the staff, on the White Elephant Anglo-Ashanti Hospital, which the province still doesn't own, and it treats a handful of patients. And it also includes 430 million rand wasted on cleaning schools. The Honourable Premier should be ashamed that he has to hand over the repair of Makhura Hospital to a national department after months of delay that has increased the suffering of thousands of patients. He should be ashamed because the extra deaths from this fiasco will be far more than the 144 life-saving patients who died on his watch. He should be ashamed because he keeps appointing MECs and heads of departments who don't prevent corruption. These are the appointments we know about, but what about these cadre deployments that the Zondo Commission has established from the ANC's National Deployment Committee? Madam Speaker, in medical matters they always say that prevention is better than cure. And it's quite clear that MEC Tasneem Makhura should go, just as you fired the Honourable Bandile Masuku for failing to prevent corruption. Now that would be real consequence management because the rot starts at the top. It's very simple what needs to be done to fix what is wrong here. Firstly, stop cadre deployment and put the best people in the right job. Secondly, implement all the recommendations of the Auditor General. Thirdly, release all the corruption reports and act on their recommendations. And finally, in the case of hospitals, give the CEOs control over maintenance and repairs. And I wish to say to you, these are very simple steps. These will make an enormous difference in improving the vital government services that the most vulnerable people in our province need the most. Thank you.